When discussing the health of Northern Arizona, someone could look at it very broadly and say Northern Arizona has worse health compared to some other areas of the state. But it's really important to understand that it's not one-dimensional of good or bad. There are a lot of factors that play into it, and it really does vary by county. The region as a whole does report higher fatalities for a number of diseases and conditions such as chronic liver disease, heart disease, suicide, and accidental injuries. But we see a really big difference in terms of health with rural areas and the urban areas. So Coconino County, where Flagstaff is, has one of the biggest urban areas of Northern Arizona. Coconino County has the highest life expectancy and the highest overall health compared to the surrounding counties. The surrounding counties that are more rural have lower life expectancy and lower overall health. And we also see a really big difference when it comes to ethnicities and health. So the American Indian population has a lower life expectancy and lower overall health compared to specifically the white population, but a lot of the other minorities as well. And we'll get more into the factors behind that further on in the presentation.
First and foremost was the limited access to healthcare that we wanted to look at. There's a major shortage of providers across the board in these areas. All providers, including dentists, doctors, nurses, etc., as well as behavioral healthcare providers, are needed and difficult to recruit. Some of the figures for psychologists that were interesting included the ratio of patients to providers sitting at 1,153 to 1 in Apache County, 1,772 to 1 in Gila County, and 543 to 1 in Coconino County. The lack of access to healthcare leads many people to not pursue it at all and leads to a decline in personal health. For those that do pursue help, they have to drive long distances to get to the provider, but may not be able to do that because they don't have their own transportation, limiting their access to those resources as well as their access to healthy food and medications as well. On the economic side of the social determinants of health, all 6 of the listed counties had higher percentages of children living in poverty than the national rates. Similarly, the percentage of kids experiencing food insecurity ranged from about 22 to 38% in the given counties. Unemployment rates in these areas were also high, above 5% in all of them, which leads a lot of people to have lower self-esteem, overall depression, and then that feeds back into the cycle of having insufficient resources for mental health. Briefly touching on the education aspect, the high school dropout rates in these areas stay typically between 30 and 37%. And as we've heard, there is a link between lower education levels and higher mental health issues, as well as physical health issues like cardiovascular disease. And then kind of to round it out, in the social and cultural area, found it was interesting. A lot of American Indian communities stated that historical trauma and loss of culture were contributing to their poor mental health.
In the report selected, there is not a specific role for the PT. It is identified that there is a need for increased communication between providers and the need for encouraging and facilitating collaboration. Wherever possible, behavioral health services should be integrated into primary care settings as well as other settings to increase awareness of mental and behavioral health issues. I think there is more urgency for all healthcare professionals to collaborate and raise awareness. PTs are specifically trained to identify and recognize certain signs and symptoms. They then can refer individuals to the correct specialists and educate them on how to prevent further issues. As a PT, there is more time spent with individuals to create a trusting relationship, and this is a very important role. And this allows for increased communication between individuals and other professionals. I think the key role of the PT is to collaborate, communicate, recognize, and educate based off this report.
We suggest that the Department of Physical Therapy at Northern Arizona University organize some type of after-school youth program expressly for the purpose of mentoring youngsters from underserved communities. This is largely because physical therapy is unique to other areas of medicine insofar that clinicians can develop closer relationships with patients and help them adopt longer-lasting, healthier behaviors. So an after-school program guided by physical therapists has the potential for steering members of the community from an earlier age into recognizing the value of regular exercise and meeting long-term healthy outcomes. Now, economically speaking, after-school youth programs provide slight respite when it comes to parents balancing work with family life. Now, the implication here is that parents would have more latitude in stabilizing their lives professionally to better provide for their children. And it also offers parents peace of mind knowing the whereabouts of their children when working. So why physical therapists? Because physical therapists are trained to identify gross pathological signs and symptoms of dysfunction and the related etiology, and they're far more apt than other healthcare professionals in offering constructive feedback on how a person might correct movement patterns in the name of being healthier. But quarterbacking a lot of these changes is almost exclusively predicated on his or her, the therapist's, ability to build rapport and trust with the patient. So establishing a mentorship program means that physical therapists would have more opportunities to establish this rapport and trust in a subpopulation that's far more pliable to change, improving community health from the ground up by teaching kids how to be healthier, who in turn model behavior and practices for parents and siblings.
So our target population is going to be about from 6th grade to senior year of high school. We're going to try to have those mentorship relationships within that. And then the physical therapists are going to come in and show them different organized activities, sports, anything that's just going to get them moving. That would be fun. And while they're doing this, physical therapists are able to observe their body mechanics, make sure no one has something really wacky, really off that would need to be addressed, as well as take all the kids' vitals. So we're able to see if they have abnormal heart rates, have abnormal blood pressure, and try to handle that now. And then I think the most important part will be just education on why to eat healthy, why to exercise, how beneficial it is for them in the future if they start eating healthy, working out, and working on that stuff now, as well as the positive correlation between exercise and mental health. And this would hopefully take place in a gym that's going to be between the high school and the middle school, so that transportation would not need to be figured out or an issue.
So we as a group think that this initiative is necessary because it's allowing us to address some of those social determinants of health very early on. Because this is a program targeted at kids and adolescents, we are being points of contact as healthcare providers very early on in their life, hopefully opening up the door to accessibility and trust, and hopefully this translates not just into physical therapy, but into other healthcare settings as well. And then as far as the scope of practice for the PT, we think this is perfect because it's really focusing on prevention and patient education. So physical therapists, we'd rather prevent injuries and complications before they happen rather than treat those injuries and complications. As far as measuring the success of our initiative, our goals for this program really are long-term. So we won't be able to determine the success of this program right away, but we will know later down the line if it was a success, if we are seeing those better long-term health outcomes in the future Northern Arizona Regional Health Equity Assessments.